How can you love your body and nourish your temple through a chronic illness, pain, or other debilitating condition? That's today's viewer question. It's Dr. Mary. I'm so glad you're here. We have been talking about the 7 principles of what being a well-nourished woman means to me. So this week's question could not have come at a better time. So I was talking to a woman yesterday who has just been through, in the past few years, a lot of debilitating pain. She was in a car wreck that ended up injuring her back and her neck, and the doctors were never really able to get everything to go back in alignment through adjustments or massage. And finally, it's gotten to the point that she's now on her 3rd surgery for neck and back pain. And it's been a struggle. She lives on painkillers every day just to get through the day. So we were just talking about, how do you do this? How do you love your body and be grateful for your body when it seems on the surface that your body is betraying you? It's preventing you from doing the things that you want to do and the things that you love most in life to do. So I'm so glad that I had this conversation yesterday because it really informs today's principle, which is listen to your body. I truly believe, from my own decades of experience in doing this, that your body can be one of your greatest messengers. If something hurts, if something doesn't feel right, that's a sign. That's a sign for you to wake up and pay attention and ask what's going on. Now, sometimes the cause of your pain might be very clear. It may be a car wreck that caused whiplash, that caused an injury. It might be an accident that you had that caused pain. So if you sprain your ankle and your foot swells, that's a clear connection between the event and the pain. But sometimes, even despite that, the pain doesn't go away, or your body isn't healing the way that you and your physicians expect it to, or maybe it's something that is just unexplained. There seems to be no cause for it. So in those situations where something just isn't healing, or it's not progressing the way that you want it to, or you think you should, or it just seems to have no origin. So your back is hurting and you didn't do anything to pull it. You didn't get in a car wreck. There was no antecedent to that back pain or to whatever it is. Then that's the time when I really encourage you to go within and ask your body, what's going on? Why? So if it's pain, put your hands on the area of the body and ask yourself, why do you hurt? And just wait for the answer to bubble up. If it's something that is not pain related, but is, a chronic illness that just seems like won't go away, it's not getting any better, then ask whatever area is affected or your body in general, what's the lesson I'm supposed to learn here? What am I not seeing? So I shared with you a couple of weeks ago an example about a former client of mine. This has been a couple of years ago now. And she had come to me because she had been having chest pains. And she'd run the gamut of tests by cardiologists. She'd had all kinds of tests. And her chest pain had been going on for months. And they couldn't find anything physically wrong with her. So they finally said, it's psychosomatic. You need to figure this out on your own. And the poor woman just couldn't, clearly, you can believe if you've been having chest pains for months, that's something that you really want to, it's your heart, right? So you want to make sure that there's nothing wrong with it. And she'd had all these tests run and nobody could find anything wrong with it and it wouldn't go away. She came to me in desperation because her doctors kept telling her it's psychosomatic. There's nothing wrong with you. And she was convinced there was something wrong with her. So she came to me as a psychologist in desperation because her doctors kept telling her it's in your head. And so by the time she came to me, she thought she was crazy. Am I imagining this chest pain? It's been going on for months. Why Why? What's going on here? In one conversation, it was so clear to me what was going on. And all I ended up doing, because I believe in the coaching model and that you hold the answers to your own problems inside of you, I'm just a guide there to help point you in the right direction. So I said to her, why is your heart breaking? And all it took was one question, and the floodgate opened. And for the next hour together, our hour session, she talked about her failing marriage and how she and her husband were at wit's end after 20-something years, and they were on the brink of calling it and throwing in the towel and filing for divorce. They weren't talking, they weren't communicating, they were like roommates that didn't speak to each other living in the same household. And it had been that way for years, but it had gotten increasingly worse. That's why her heart was breaking. That's why she was having chest pain. So it's a simple, effective exercise. If you're having something that's going wrong with your body, it could be pain, it could be other symptoms, it could be a rash, it could be whatever it may be, and you can't find the cause for it. So there was no antecedent event like you ate something you know you're allergic to, or you had a car wreck or something like that. I encourage you to actually ask your body, what is this? And if it's something that's a chronic condition and it's not going away no matter what you do, what lesson am I supposed to learn here? What am I not seeing? What am I not learning? Why are you still hanging out here? What am I not getting? I hope that helps answer the question. And I hope that you are able to find some answers to what's going on with your chronic pain. And for those of you who have any other chronic issues or things that are lingering or lurking about, I hope that you can use this very simple, quick method to go within, talk to your body, and listen to what it has to tell you. It's Dr. Mary. Next week, we'll be back with principle number 4. Much love.